Dr. Gerald Chodak. You've gone to your doctor complaining of urinary symptoms, slowing of the stream, nighttime urination, urinary frequency. Just you're urinating in a different way and it's bothering you. It's interfering with your sleep, and now you want to have something done for it. What do? Well, the mainstay treatment, the first thing we're going to do is offer you medical therapy. That's assuming that it's not medication related and it's not lifestyle related. We're talking about a man whose problem is due to urinary obstruction secondary to an enlargement in their prostate. And medical management is certainly the thing to try before surgical management because it's easier to do. The downside of medical management is you may be on it for the rest of your life, but it can avoid having some surgery. So how do we manage it? We actually have two different ways of doing this. The first way is with a pill that relaxes the muscle cells that are in the prostate gland. And by doing so, the urine is able to flow out of the bladder more easily. So the stream gets stronger, the bladder empties better, your bladder will relax and not cause the problem making you get up in the nighttime, and just your overall symptoms can improve. These pills are taken once a day at bedtime, and there are several on the market. No one has proven that one is necessarily better than the other, although there are some modifications as to the side effects that occur with each of the different options. But they both work in the same, they all work in the same way. They relax the smooth muscle cells, they improve the symptoms, and they can do it very quickly, with just in a couple of days. So you can find out very quickly whether your symptoms will improve enough to relieve you and make your quality of life improve. Now, there is a second option, and that second option is to give you a medication that will shrink the size of the prostate. And studies have shown that if you have symptoms, and if your prostate is above a certain size of about 25 grams, then you actually will do better by taking both medications. Taking the medication that relaxes the muscle cells and taking the medication that will shrink the prostate gland. And here too, there are several options available for shrinking the prostate gland. And so the idea is, let's treat you in two ways and get a more complete response. The relaxing of the muscle cells doesn't prevent you from getting worse, but it relieves your symptoms now. Whereas the medicine that shrinks your prostate actually is like resetting a clock. It's reducing the size of your prostate to the way it was years in the past. And studies have shown that using the medication to shrink the prostate can reduce the likelihood of you needing surgery in the future. So this is the standard way to approach a man that has urinary difficulties. Before considering surgery, offer him these two medications depending on the size of the prostate. The medicine that relaxes the smooth muscle cells, we call it an alpha blocker, and the second medication is a drug that will shrink the prostate. Combining those two together gives you the best result. Thank you.